Um, our own CS for Health, CS Wachira, in 2013, while attending the WHO conference on human resources in Brazil in 2013, made a commitment and signed that we agree as a country that actually we may not be able to achieve universal health coverage because of the dire shortage in human resources that we do have. And he signed that from 2013 to 2017, they would employ 12,000 healthcare workers every year. That is 60,000 healthcare workers in 5 years, so that at least they can take the staffing norms to the baseline. As we speak today, and I think it's only good that Kenyans know, most of the patients we are losing is not because we are supposed to lose them. It is because, number one, we could not be able to prevent their disease, and number two, when they come to us, in some way, they are either misdiagnosed because of the fatigue, because there are guidelines. Unlike for a clinic officer, you are not supposed to see more than probably 38 patients in 8 hours, if you are to give them around 15 minutes each. And probably some will have more time. But you find in some areas, a clinic officer seeing 150 within the 8 hours. What that means is that when I'm seeing my 50th patient, fatigue is going to set in. And if you are to Google the simple symptoms of fatigue that is related to work, you'll find that you will not be able to concentrate, you will be irritable, your mental capacity to be able to see things clearly is clouded. Probably that will arise in a misdiagnosis, complications. Then this patient is going to land with a complication in a ward somewhere. And I must also say that most of the patients in our inpatient, they do not die because they are supposed to die. Most of them, especially the critically ill, they die because of lack of proper nursing care. Because sometimes you find you have a ward of more than 50 patients with only 2 nurses. It is not humanly possible for them to be able to take care of these people. Because sometimes we have theoretical and political discussions, and we detach the objective of the healthcare workers on what is supposed to happen. Having said that, I must say that universal health coverage, healthcare for all, Article 43, which mandates the government to provide this, it is an investment. It is not something that happens by default. It is an investment that the government must be able to put in place, put a plan, because when you tell us you had a cohort of 8,500 and something for 3 years, having employed them during a pandemic, and of course we knew, and we even called them UHC. And we didn't say that UHC is for 5 years and then we are going to pack up and go. Universal health care, we said it's here to stay. We want affordable health for all Kenyans eternally going forward. And so you cannot then tell us, now we don't have money to transition these people. What you are telling us is that we didn't plan. And that is why we were asking the question of, if we have not planned for people we knew, and we knew this contract was going to end at this point, then how are we going to plan for the other 20,000 that we have projected? And the other thing I wanted to correct is that it's not all the interns that have been posted. Mm-hmm. Actually, the clinical officer interns, 1,840, have not been posted. They qualified a year ago. They have been for 1 year at home. What this means is that they cannot be able to practice. Then they lose 1 year because the government has not planned, of which it's something that has been happening for over 20 years. Actually beyond, since I think since inception in 1927 when we started clinical medicine, we have been going for intern